What do you hope to get from your tour? What is the purpose of that?
Well, so I kind of use the analogy of a funnel. We started the process with a pretty wide funnel with surveys and community discussions and engaging with dozens of organizations around the state asking, what would you like to see out of CCOs in the next iteration? What do you think better means for coordinated care organizations? And we've boiled that down to a long list of policy choices. It's the first ever 100-slide PowerPoint I've ever sat through, and it was actually really interesting to go through the different choices and options. And so now what we want to do is we want to go back out to communities and say, well, here's what we're thinking. Here are some of the options we have. Here are some ideas that we think maybe are good ones. What do you think? Are we on the right track? Are there things on this list that you think are great ideas? Things that you think are terrible ideas? Are there topics that we just haven't addressed well enough at all yet? We want to begin to narrow the funnel from the sky's the limit to here's a practical set of things that we're looking at so that we can go back to the Health Policy Board and say, here are the recommendations of what we think need to be in these contracts and in the system structurally going forward for the next 5-year round of contracts.
What are the challenges, and there are many, but what are some of the key challenges facing CCOs going forward?
Well, I think like anything, when you're trying to constrain costs, the easy stuff is the easy stuff and you do it first. And once you've done the easy stuff, it's not around to do anymore. And so the lifts get harder as you try to squeeze down on that. We're also beginning to have a conversation that you probably know that we use a 3.4% growth rate in Medicaid, and we've often referred to that as a constrained sustainable rate of growth. Well, it's actually not. The economy only grows by about 2% a year, and so at 3.4%, if that's where you stay forever, you're sort of committing yourself to spend more and more and more of your income on healthcare. Ultimately, we actually have to ratchet that number down even further and get it closer to that 2% number. So I think trying to continue to find ways to improve practices to be able to save funds, to improve population health. I think that's the other big challenge is how as a CCO are you able to transcend the 25% of Oregonians you directly serve to the 4 million Oregonians that all live within the catchment areas of CCOs, work together with public health, figure out ways to drive down incidence of disease and those kinds of things, so you improve the overall health of Oregonians and thereby drive down healthcare costs. I think that's also a big challenge for CCOs.